Hey everyone, my name is Jaime, and I have created a YouTube channel for respiratory therapists. It is called the Respiratory Therapy Resource Center, and today I made a video about home therapies people can do for treatment of COVID-19. So, first of all, I want to give a short disclaimer. I'm not a physician. I'm not a practicing medical doctor. I have a respiratory therapy degree and I practice in Houston, Texas, and I treat many patients who have respiratory related illness. So, if you want a more detailed disclaimer, please refer to my description. But let's continue on with the COVID-19 home therapies. So, some symptoms of COVID-19 include the fever, dry cough, nausea, vomiting, headache, fatigue. But I would say the hallmark of this disease would be the shortness of breath, right? So, shortness of breath, especially if you're an otherwise healthy individual, is definitely worthy of going to an urgent care or going to an emergency room if there's no urgent care available in your area. So, that would be when I would say to start using some of the tips and tricks that I'm going to present in this video. So some of the things that you may experience if you get COVID-19 are bronchospasm, and you may wheeze when you have that bronchospasm happening. You may have increased mucus production. Again, don't forget, the symptoms vary from patient to patient. Some patients are asymptomatic, won't experience anything. Other patients will experience other symptoms, mild, moderate, and severe, right? So you may experience bronchospasm, you may experience increased mucus production, and you may experience decreased oxygen levels. So this is just a general clinical course. It doesn't mean this is going to happen to you, but 80% of people do not need hospitalization, okay? And if you do, it doesn't mean you're going to be intubated on a breathing machine either. You may just need some supplemental oxygen, okay? So there's some tools that I want to talk to you guys about. I think these tools will be very useful in this situation, especially with our medical services being a little bit tied up with multiple coronavirus patients coming into the ER. One is a thermometer. It's a very, useful tool to have around, especially at a time like this. Make sure, you're checking to see if you have a temperature, especially if you're symptomatic and fever is classified as 100 degrees and above. A pulse oximeter. So this is going to be an extremely useful tool for people in this situation. So a pulse oximeter is like the one shown in the photo. You can buy it on Amazon. You can buy it probably from a drugstore. Amazon probably has a better chance of having it in stock and being able to deliver it. So, and just like it shows in the picture, you kind of press it and it opens up and then you put your finger in it and it gives you back two values, two very important and useful values. One value is your heart rate, and the normal heart rate for an adult patient is 60 to 100 beats a minute. And the other value, which is going to be of particular use in this situation, is going to show the oxygen saturation, for which if you have an oxygen saturation of 89% or below, that warrants a trip to the emergency room, okay? So this kind of is useful in the fact that it gives you more information, right? You have more information. You may be sitting at home wondering, should I go to the ER? I don't know if I should go to the ER. Absolutely. If you have 89% oxygen saturation, you should go to the emergency room, okay? So the normal value for oxygen saturation is 90 to 100 in a healthy patient, okay? So for the bronchospasm, if you experience bronchospasm, you have options of bronchodilators. So call your doctor, see if you can get him to send in a prescription for any of the following bronchodilators. Albuterol sulfate is one of the most common bronchodilators on the planet, right? Xopenex is an isomer of that same medication. It has a little bit less side effects. It is more expensive. And Atrovent is also an effective bronchodilator, okay? The most common side effect from albuterol sulfate would be increased heart rate and maybe a feeling of jumpiness associated with that, but it's nothing unbearable. If you have heart issues, talk to your doctor before starting this medication. And all of these medications, be sure you talk to your doctor about each medication and what you guys agree on as to which one is the best one for you, okay? So there's a nebulizer machine that the doctor would have to order for you. These are going to be reserved for patients who already have some type of respiratory illness. And maybe a lot of these patients might already have their own nebulizer machine at home. And if you don't, that's okay. And you may not need one, right? It's just a thought I decided to kind of put in this slideshow, okay? There's also a meter dose inhaler, MDI, and most people commonly call them inhalers. That would be sufficient in this situation as well. So for the increased mucus production, there's several things that you can do at home to aid with that issue, right? Like manage that increased mucus production. So I have found a lot of use in lavender and peppermint essential oils myself. And the way you use these is you mix them with a carrier oil, such as grapeseed oil or coconut oil. The one thing I would tell you to kind of watch out for with lavender and peppermint essential oil is the skin irritation, right? So you can put it under your nose, on your neck, on your chin, right? Your chin probably will hold up a little bit better versus under your nose as far as skin irritation is concerned. And if you really have sensitive skin, you can definitely put it on your shirt. On your shirt. That would be a totally fine place to put it as well. So you can also get Vicks Vapor Rub, for which you can rub on your chest, or you can rub a sock around your neck and still get the effects of mucus relief, right? From Vicks Vapor Rub, that can be found at any common pharmacy in our country, right? Walmart, Walgreens, any of them, right? So a humidifier could also definitely be beneficial for patients who are dealing with increased mucus production at home. And another really good medication I have benefited from in the past is Mucinex. And I do not recommend getting the DM version of Mucinex. I would just get the regular Mucinex medication from the pharmacy, okay? It's OTC, over the counter. I would start with the 600 milligram because it can be a little bit harsh on the kidneys. I know when I was sick for a period of a week or two, I was taking Mucinex continuously, the 1200 milligram dose, and I started to have back pain. And once I read the label a little bit closer, it can affect the kidneys. You're not going to go into kidney failure from it, but I mean, I didn't want to have back pain, right? So I think the 600 milligram dose is sufficient, and talk to your doctor about it if you're really concerned about Mucinex, but that's my recommendation, okay? So another thing you can do for the increased mucus production includes taking a shower with steam, and you can do chest physiotherapy while you're in the shower. And chest physiotherapy, I would recommend doing every 2 to 4 hours or more, right? However frequent you need to do it. You're at home, and however many times you need to do it a day is what you need to do, right? For you to feel comfortable, okay? So a little bit more about CPT is if you're going to do CPT on yourself, you make a fist and then you just beat on your chest, right? You beat on your own chest, and this helps break up the mucus. If you're going to do CPT on another person or a family member, you make cupped hands and you pat your hands on their back, and they lay on their side, and then you just moderately, with some force, right, hit their back, right? The point is to try and break the mucus up, right? You can put a towel over their back as to reduce skin irritation to their skin, right? You don't want to irritate their skin too much. You can put a towel, put the cupped hands, get your cupped hands ready, and then just hit their back and help break up that mucus, okay? And that, like I said, every 2 to 4 hours, it's at your discretion, you know? For the decreased oxygen saturation, if you're experiencing this, use your pulse oximeter. Make sure you have a decreased oxygen saturation. If it is 89%, make sure you go to the emergency room. Even in the hospital now, I've read some things where they are practicing what's called prone positioning in patients who are not intubated. Typically, we reserve prone positioning clinically in the hospital for patients who are already intubated on a ventilator, but they're starting to find really good results with the same prone positioning in patients who are only on supplemental oxygen. So you can do this at home as well, and this is also going to help relieve your lungs from the pressure of the heart, right? So what prone positioning is you laying flat on your stomach face down in your bed, and you should be face down and turn your head one direction, and feel free to put a pillow under one of your shoulders in whichever way you feel most comfortable, okay? So it's effective at reducing the pressure of the heart on the lungs, laying on the lungs, and increasing your oxygen saturation, okay? So other ways to keep your lungs open and other advice that I have is do not lay flat in your bed. That will be one of the most fast ways that your lungs are going to get used to not being used. So you don't want your lungs to get used to that, right? You don't want them to get used to not being inflated. You do not want to lay flat in bed, okay? And when you are sleeping at night, you do want to put pillows under your back and maintain at least a 30-degree angle. 3 to 4 pillows, I'm sure, would be sufficient to achieve that angle. And you want to turn every 2 to 4 hours. In the hospital, we turn our patients every 4 hours, okay? But feel free, turn every 2 to 4 hours. And I'm sure you're probably going to be somewhat awake. It's not going to be like the most comfortable sleep you ever got in your life when you have COVID-19, I'm sure. But just make sure you're turning every 2 to 4 hours. And if you're in bed during the day, you just can't get out of bed, make sure you keep that 30-degree angle and make sure you turn every 2 to 4 hours. My other piece of advice would be to try and stay out of bed as much as possible. Walking around your apartment, your house, wherever you live is going to also be very beneficial to keeping your lungs open, okay? So another thing about how to keep your lungs open is doing breath holds throughout the day for about 5 to 10 seconds. And you want to do these breath holds maybe every 2 to 4 hours as needed, right? This is going to help prevent your lungs from getting tired, from possibly collapsing, right? So this is going to help prevent that. And that's what you want, right? You're at home, you're trying to do everything you can to stay out of the hospital. You can do all of these things. My advice for going to the emergency room is when your saturation is 89, that is a non-negotiable. I recommend everyone go to the ER if their saturation is 89 or below. And also, if you have shortness of breath, I recommend going to an urgent care or an ER. Definitely call your physician, make an appointment, and go to the ER, okay? So those are my recommendations for keeping your lungs open. And if you got something out of this video, please feel free to subscribe to my channel, Respiratory Therapy Resource Center on YouTube. And I really hope that this video reaches whoever it needs to reach as we continue on reopening our country. Just remember, don't be too afraid, just be prepared. That is what is going to differentiate the outcome for most people. Be prepared, educate yourself, and be ready to, just prevention. Try and prevent getting sick as much as you can. If you do get sick, just follow the normal pattern of the healthcare system, right? Go to the ER. If you're not admitted, you can do these things in this video to try and help yourself at home, okay, and your loved ones. I hope you all have a great day, and I wish you the best of luck. Thanks so much. Have a good one.